The purpose of the presentation is to provide an introduction to the One Woundcare Formulary for Greater Manchester. The benefits of a single Greater Manchester formulary, obviously a single standardised wound care formulary would save on resources, so it cuts out the need for every tissue viability lead nurse and the colleagues to have to keep redrafting their trust wound care formularies. The idea is that it will support patients, so it's going to provide a standardised approach to wound care and product benefits. So patients moving between one healthcare institution and another across the Greater Manchester area will receive that standardised approach to the products that they receive for their wounds. It supports clinical staff, so it makes it easier for those staff members that may work in different areas of the trust to be able to understand what's on the formulary and provide that seamless patient service. It saves on costs, so by working in collaboration with procurement, the Super Trust will be able to bring savings through that accumulation of buying products in volume, and it creates a true partnership with suppliers, so working together with suppliers to innovate and bring new products to the market. So who owns the GM formulary? So the group is built up by clinical professionals and experts and procurement professionals from the Greater Manchester Trust. And the group will review and update the formulary based on clinical quality, generic specification and pricing initiatives. So it will regularly review all those aspects that ensured products got onto the formulary. It will be the gateway for supplier engagement, so companies can engage with the group to obviously introduce new product innovations. It will accept and oversee trialling and testing of wound care products for all of the Greater Manchester Trust. And it will monitor the take-up and usage of the wound care formulary products across Greater Manchester to make sure that obviously there is compliance with all members of staff utilising the products on formulary. The group will continuously on wound care education and training initiatives to make sure that obviously aspects of training and education are delivered to the areas where they need it, and specifically looking at certain topic areas that are applicable to your area of practice. And it will ensure relevant research and clinical evidence is considered to make sure that obviously they're making informed judgments about what products are on the formulary and of course what products do end up being removed from the formulary. So we're going to talk about Kliniderm Foam Silicone, a gentle and conformable dressing that patients have reported is comfortable when being used on various types of wounds. So when thinking about wounds, obviously wounds can be classified as either acute, so traumatic or surgical, and these are the wounds that we expect to move rapidly through the normal stages of wound healing and actually show signs of healing within 4 weeks. Or chronic wounds, so they fail to proceed through normal stages of healing and often get stalled in one of the phases and show no evidence at healing within 4 weeks. So thinking about those 4 stages of wound healing, so your hemostasis phase, and that obviously occurs following injury to the body or any trauma to the skin that penetrates the dermis, and that would obviously result in bleeding, and you'll get the formation of a clot. So obviously that's the body's objective to stop the bleeding, and the blood vessels in the wound bed will contract, and that is how you get your coagulation of your clot. The next stage is the inflammatory phase, and obviously after the tissue injury, after the coagulation, this is where the neutrophils are increased and the granulocytes, and obviously that's the body's purpose then to focus on destroying the bacteria in the wound, removing any debris, and essentially is your body's way of cleaning the wound bed and enabling it to be prepared for new tissue regrowth. You then move on to the proliferation phase, and obviously these are typical days within each phase that we would expect, but every patient varies depending on their clinical background and what they've got going on physiologically. So the proliferation stage is where the new tissue is made up of the healthy, rich collagen, the extracellular matrix is generated, and that's when you start to see the granulation tissue beginning to form, and the fibronectin and the hyaluronic acid. Once you've moved through the proliferation stage, you then obviously move to the maturation stage or the remodeling, and you get further deposits of collagen, and that's when the wound fully closes and the new tissue slowly gains strength and flexibility around that scar tissue to be a fully healed wound. Obviously, if you've got a patient who has got some immunocompromise, so if they have got abnormal sort of white cell count or neutrophils, patients can get stuck in the inflammatory stage for significantly longer than what we would typically expect, or they could get stuck in that stage altogether. Obviously, if you've got inadequate wound perfusion, so if you've got poor venous supply to a wound, so you've not got that supply to carry that really healthy oxygen-enriched blood, particularly when we think about leg ulceration, when you've got vascular compromise, then that obviously has an impact at looking at delayed wound healing. So thinking about the foam, the Kliniderm Foam Silicone. So foam silicone dressings, they're a soft, conformable, absorbent polyurethane foam dressing, and they come with an adhesive silicone wound contact layer and a moisture permeable film backing. Dressings are available with or without a border and in standard or light versions, depending on what level of wound exudate and what the clinical features of the wound care needs are. And the Kliniderm Foam Silicone range provides a skin-friendly adhesive, and that obviously reduces the risk of skin damage, atraumatic skin injury on removal of the dressing. So looking at the makeup of the foam silicone dressing, so this is obviously a breakup of the bordered dressing. So you've got your vapor permeable polyurethane film, so it acts as a barrier to fluid. So obviously fluid going into the wound, but also microorganisms, and it helps with the optimal moisture balance because of the moisture vapor transfer rate. And then the next layer you've got is the super absorbent fibres. So that works by locking the exudate into the dressing and obviously helps to prevent peri-wound edge maceration, fluid overload within the wound. You've then got the non-woven fabric, so that aids to transfer the fluid up into the super absorbent fibres. You've got a layer of absorbent foam, so that absorbs fluid into the dressing, but obviously it helps by maintaining that moist wound healing that we would expect to see. It's making sure that it's not overloading the wound because we've got that super absorbent layer, but it's just keeping a nice moist microclimate for the wound. And then finally, you've got the silicone adhesive layer, which obviously conforms to the skin with the warmth of the skin, conforms to the wound, and then obviously provides that atraumatic removal. It's gentle on removal when you're removing it from the patient. So the range offers a wide range of shapes and sizes depending on what your patient's clinical needs are. So there is the standard foam silicone border, and they come in sacral and heel shapes. So you have different shapes other than your standard rectangle or square shapes, and they're ideal for low to moderately exuding wounds. We also do that in a light border. So obviously that's a thinner, more conformable dressing, which is more suitable for low exuding wounds. And then also we offer the dressing without the border. And with that, again, you get the heel shape foam, ideal for low to moderate exuding wounds. And that also comes in the light version, which is really conformable and comfortable and lightweight, especially areas that are difficult to dress. So difficult anatomical sites, so head and neck wounds or breast and axillary wounds, it's really comfortable to wear for the patients. So in summary, obviously the Kliniderm Foam Silicone provides a lot of key benefits for the clinicians and the patients. So we know it's got the gentle silicone adhesive, and that minimises the risk of pain as well on removal of the dressing. It's comfortable. Obviously, we want patients, if they're having to wear dressings for a significant period of time, to be comfortable with these. We know that they absorb and manage the exudate, and in turn, they help protect the surrounding skin and protect the moist wound healing. The skin friendly. It's very safe for you to be able to remove it from even fragile skin, particularly patients that may have been on long-term steroid use or elderly and they have that very tissue paper skin. We know that the dressings are all effective under compression, so bandages and hosiery. So if you've got patients who have got wounds due to leg ulceration or lymphedema, these dressings can be used under the bandaging and hosiery garments. They're easy to apply. The dressings have up to 7 days wear time, but obviously depending on clinical need, they can be changed more frequently. They provide a protective barrier to prevent microorganisms entering the wound. We have a wide range of shapes and sizes available on the formulary, and the bordered dressing is shower proof. Obviously a light shower in, not a saturation of water, but they are shower proof. So when thinking about clinical effectiveness in a study done around Kliniderm Foam Silicone, it was found to be above 80% in all areas that was asked. So ability to manage exudate 100%, ease of removal 89%, and obviously most importantly the customer satisfaction and the conformability and comfort, which again achieved high up between 88% and 99.9%. So thinking about the types of wounds that you may use these dressings on, particularly like to concentrate on skin tear management. And obviously audits took place in a nursing home setting that showed Kliniderm Foam Silicone dressings were an effective dressing to be used on skin tears. I would like to point out that if you do have a particular trust skin tear protocol, then obviously you would need to, as a clinician, follow that. But looking at skin tear management, obviously the study found that the Kliniderm dressing stayed in place. It was easy to remove, despite the fact that obviously a lot of the patients had fragile skin, which led them on to have a skin tear. It provided cost savings in terms of standard traditional skin tear management, and it had comparable healing rates. So when thinking about how you'd use a silicone dressing on skin tears, it's ideal because it's comfortable. It facilitates flap security, so providing you've still got that skin integrity there, you've still got that viable flap. It's easy to apply, and obviously it's pain-free on removal. It protects the peri-wound skin and it controls the exudate depending on the levels that you may have, particularly if you are dressing a skin tear on a lower limb that may be edematous. So how we would expect a skin flap to be treated, obviously the wound would need to be thoroughly cleansed with whatever cleansing agents it has advised you use, and ensure that the skin flaps are pulled downwards to cover the wound again. Any viable skin that's still present is obviously redistributed back over the wound and to try and cover those edges again and bring those edges together without any rolled edges tucked in, to ensure that obviously the wound has the best chance of healing. When applying the silicone dressing, you obviously are going to document an arrow to demonstrate the direction in which the skin tear occurred. Apply the dressing in the direction of the arrow, and then obviously once you feel that the skin tear will have healed, depending on the length of days you leave the dressing on, you would then remove the dressing in the direction of the arrow. So that is demonstrating that obviously you've pulled that skin flap down and secured it with a gentle silicone dressing. You've then removed it in the direction of the skin flap so that you're not going to obviously encourage that skin flap opening back up again. Again, referring back to your own trust skin tear protocol or pathway if you have one, it is recommended now not to use closure strips to bring the wound edges back together. They're the traditional steri strips, because obviously they can be quite traumatic again on removal. Do change your secondary dressing on a regular basis if you do require one. Do leave a wound contact layer in place when redressing the wound. So if you were using a silicone contact layer as opposed to the Kliniderm Foam Silicone dressing, and because your wound exudate is quite high, then obviously you'd need to change your secondary dressing based on the exudate level. We've already talked about the reasons why you draw an arrow on the dressing, so that you're going to ensure safe removal of your dressing and not to reopen that skin tear. Obviously, we want you to monitor for further signs of breakdown. We need you to monitor for signs of infection at each dressing change, and they are your usual signs of infection, so your erythema, your tracking cellulitis, offensive odour, increased pain. Obviously, if your flap is non-viable or your flap is completely removed during injury, you'd need to look at obviously making sure that additional dressings are used and that wound is assessed based on what the wound actually presents at the time. Obviously, if you are noticing some deterioration in the wound or there's no improvement, or you're concerned about circulation to the flap, then you'd need to discuss with somebody else. And then obviously leave a 2 centimetre overlap around the wound, and that's from the dressing point of view. Obviously, once your wound is healed, your skin flap has come back in contact with the healthy skin, then you can discontinue dressings and follow good skincare regimes. So thinking about application instructions, the Kliniderm Foam Silicone range are very easy to use. Obviously ensure the wound is clean and dry, so the surrounding skin is nice and dry, because obviously moisture stops silicone having that tack effect, and that's how it's atraumatic on removal to wounds. doesn't take healthy granulation tissue off the wound because it loses that tack once it's become wet. So you need to make sure your surrounding skin is nice and dry to get a good adherence from your dressing. Obviously, make sure you're selecting a dressing that's big enough to give you an overlap of wound margin by 2 centimetres. And again, choose your dressing based on exudate level. If your wound is not exuding a heavily amount, then it's better to go for the light dressing, because that's going to give you better cost savings in the long run and obviously be more comfortable and conformable for the patient. Obviously, remove the backing pieces that are very clearly labelled and place directly to the wound bed and gently press the adhesive border to secure the dressing. Obviously, like I already said, the Kliniderm Foam Silicone dressings can be left in situ for up to 7 days. Depending on wound, they can obviously be changed more frequently, and there's no restriction on length of use, but obviously monitor and review the wound progress, any changes to the wound bed regularly. So indications for use, the Kliniderm Foam Silicone dressings are very broad spectrum dressing. They're suitable for lots of different types of wounds. Obviously, chronic and acute wounds, pressure ulcers, diabetic foot ulcers, leg ulcers we've already mentioned, post-op wounds, skin abrasions, superficial and partial thickness burns, donor site, traumatic wounds, skin tears. And obviously, like already mentioned, the non-bordered light dressings are also very comfortable for patients undergoing radiotherapy who may have radiotherapy skin reactions or fungating wounds depending on level of exudate. So thinking about cost effectiveness, obviously, as well as ensuring clinical effectiveness, we need to be able to demonstrate that we are making savers without compromising quality. So the Kliniderm Foam Silicone dressing is comparable to other market-leading brands in absorption under compression, comfort, and not interfering with daily activities. And a recent study looking at different prices on drug tariff demonstrated that the Kliniderm Foam Silicone dressings can provide savings of up to 28%. So obviously the GM formulary that everybody will have a copy of has got all the order codes in, but they are here within the presentation for the different sizes of dressings. And these ones are there for border range, so the standard foam silicone border and the foam silicone light border. And again, these are the dressings without the adhesive border, just the silicone contact layer on the underside of the dressing for the standard thickness foam and obviously the light foam.